So from when is the right time to rip off the Band-Aid to worries about side effects, there have been no shortage of questions surrounding the coronavirus vaccine.
Yeah, and lucky for us, our Dr. Frank McGeorge has been answering as many as he can over the past few months. And Doc joins us live now with a new batch, starting out with the timing of that second dose. Hi, Doc.
Hey, Karen and Jason. Yeah, a viewer wants to know, can I take the second shot 2 weeks early? Well, none of the studies looked at getting the second dose earlier than recommended. In fact, there's more recent research that suggests a delayed second shot might even lead to a higher response than the recommended interval. So, no, you should not get the second shot early. Now, here are some more of your questions.
Anna asks, can vaccinated people be masking confirmed cases by being asymptomatic? Vaccinated people would not have a reason to get tested, which will affect confirmed cases reported. To some degree, wouldn't the reduction in cases be false? You're technically correct. If we do not test asymptomatic vaccinated people, they would not count as a positive case. Similarly, though, we don't routinely test asymptomatic unvaccinated people unless they're part of a routine screening program. Big picture, I see your point, but in terms of the best use of testing, because vaccinated people are so much less likely to be positive, we wouldn't be missing a meaningful number of positives. Tamara asks, can a fully vaccinated grandmother allow a 9-year-old grandchild to spend the night? If you are fully vaccinated, your risk of becoming infected is definitely low. The 9-year-old is not eligible to be vaccinated, so the question really becomes one of acceptable risk. If the grandmother doesn't have any risk for severe disease beyond age, and the grandchild isn't sick and has no known recent exposures, I'd say that's the safest circumstance. Astrid wants to know, do the vaccines harm organs or attack the immune system so you die in about 10 years? Does the immune system go into overdrive and doesn't slow down after being vaccinated? An anti-vaxxer told me without info where those claims came from. I have no idea where that claim came from, and I can only tell you that it's untrue and unsupported by any evidence.
Now, if someone can't give you the source of the claims that they're making, that's generally a red flag. And so far, the data points to the vaccines being very safe and effective.
Yeah, good to sort out the misinformation. And Frank, before I let you go, I understand there's a change today in how the variants will be named going forward. Tell me about that.
Yeah, Jason. So the World Health Organization actually announced that rather than use names tied to regions of the world like the UK variant or the South African variant, when a variant becomes important enough to be considered a variant of concern or of interest, it's going to be referred to by a designated Greek letter. So the B.1.1.7 UK variant is going to be known as Alpha. Now, this is really to avoid stigmatizing the geographic reference, but the lineage names like B.1.1.7, they are still going to need to be used since that actually does convey really important information on the genetic relations of various viruses.
Good information as always, Doc. We thank you.